Going abroad for plastic surgery? Why you should and why you shouldn't. Cost. In a lot of countries, it's a lot cheaper to get plastic surgery or other cosmetic procedures than it is in the United States or in the UK. A hair transplant in the US costs anywhere between $20,000 to $60,000, while in Greece, the cost is somewhere between €2,500 and €8,000. If you go to Turkey, and we're assuming you use a good surgeon, the cost can be anywhere between $3,000 to $5,000. Quality. People are just as vain in any part of the world as they are in the United States or the UK. There are excellent plastic surgeons abroad who provide fantastic results for local clients, and there's no reason you shouldn't use them if you're traveling. 3, go to a place you'd actually like to visit. There's many nice places in the world where they have excellent plastic surgery. You don't have to be seen by people you know. You can walk around in bandages, you can get your aftercare, and you don't have to feel self-conscious at people you know in your community seeing that you've had a procedure done. If you're going to go to a place like Turkey or South Korea, there are going to be many other people who've had procedures. It's much more like a community. You'll be talking to everybody at the hospital who's had the procedure. You can be sitting around a pool or inside of a cafe in your hotel. There's going to be many other visitors who are also patients who have bandages on their noses, around their heads, around their chins. You're going to just feel more comfortable. It feels much more like a high-end recovery center than it does a hotel. Number 4, high-quality aftercare. Aftercare can be prohibitively expensive in the US or in the UK. I was personally quoted a surgical nurse at $120 an hour in New York City. A surgical nurse in Turkey or in Brazil costs $120 a day. There's no point in paying for a world-class surgeon if you're not going to have world-class aftercare. The aftercare isn't just what you'll receive in the next following days after the surgery. It's also what you're going to be receiving over the next year. The revision surgery is included in the original price. Access to procedures that are either unavailable or restricted at home. Our sector is always evolving. There's new technology, there's new procedures, there's new looks. In certain cases, some procedures will not be available. You might have to go out of the country to receive them because either they're technologically not available or they might be prohibited. Shorter wait times. There are often world-famous surgeons at home who have 2 or 3 year waiting lists. Clinics abroad often offer faster scheduling and shorter wait times. Privacy and discretion. Going abroad is a place where people don't know you, where you can spend a few weeks in bandages and nobody's going to take a picture of you and send it to their friends. No bumping into coworkers, no bumping into the village rumor mill. Medical tourism packages. Clinics abroad often offer comprehensive medical packages, including hotel stays, transportation, and comprehensive aftercare. Especially in certain countries, higher surgeon volume means much higher experience when it comes to cosmetic procedures. Countries like Brazil, Turkey, South Korea have become hubs for international medical tourism. And the volume that top surgeons are seeing there and the experience that they are gaining is completely unique. Maybe more importantly, reasons not to go abroad. Language barrier. If your surgeon and your nurses don't speak your primary language, then there's a very high chance of miscommunication when it comes to risks, rewards, and aftercare when it comes to the surgery. There have been horror stories by patients who flew overseas who did not understand what they were getting themselves into. Information asymmetry. Because you're going to a foreign country, you don't know what the rules, what the regulations, and what the laws are. Whoever your provider is in that country needs to be very, very reputable. If you go to someone who isn't, you will not have recourse because you don't know the rules, you don't know the laws, you don't know the system, and you are going to have to leave once you're done. So while they stay there and the courts are there, you're going to go far away. And if there is anything that needs to be followed up, it's going to be very, very difficult for you to engage a lawyer, to go through the process, to figure out what kind of restitution or recompense there is. What happens if something goes seriously wrong in a foreign country? Do you have a plan about how you're going to go to a hospital, an emergency room? Who's going to take care of you if you're in serious trouble? How are you going to actually get home? Who's going to pay for any problems arising from a surgery abroad? The ultimate danger, visiting a clinic or a doctor who claims to be medically trained and is in fact a charlatan. There have been many, many horror stories about people who were real estate agents, were disqualified as doctors, who were not really nurses, who were practicing medicine and should have never been touching a patient, who have gone off and gotten patients into very serious trouble. If you think that somebody is not a doctor or not a nurse or not medically trained, run for your life. Say no. 5. Ghost surgeries. This is very common in certain countries. You go in, you meet the top surgeon, he's a professor, you love him, you love his results. Then the day of the surgery comes, they give you anesthesia. He's not the one who actually operates. It's one of his students or it's another doctor at his practice. No ongoing follow-up care at home. If you got a surgery from a surgeon abroad, then that surgeon isn't in your home country. They're not easy to go see if something comes up. If they need to see you again, you have to travel back to that country to have your follow-up. Now, this does happen in many home countries. People do fly between states to get surgery. So it's not necessarily just a foreign country thing. It's, do you want to stay local or not? It is a big advantage if you can afford it and if you have high quality near you to stay within that area. Cultural and ethical differences and aesthetic standards. Different regions consider different things natural or beautiful. So the big one these days is what's called the Turkish hairline, the straight hairline that many Turkish clinics provide. I personally like it. There's many doctors and there's many people in the West who do not like it, and they want a much more natural, dispersed look. So when you go, you really need to understand what you're going to get. If you're getting a hair transplant, make sure to ask for a European hairline instead of a Turkish hairline if that's what you want. And really be adamant on what you're looking for and really test the doctor to see if they can provide it or not. I mean, ask them point blank, can you do this? Or if another doctor from your region says, listen, those guys over there can't do it, take that under heavy consideration. Lack of legal recourse or consumer protections when it comes to plastic surgery. Different areas, different locations have different rules and different regulations. A simple example, in the UK, there's a 2-week cooling off period between a plastic surgery consultation and actually having plastic surgery. Other locations, you can have plastic surgery overnight after consultation. Keep it in mind when you go overseas. Always remember to take your time, whatever you do. You can always get another consultation. You can always think about it for another day. And when it comes to legal recourse, certain legal systems are not as efficient as others. One of the most underlooked is infection risk from travel. Flying too soon after the surgery can increase the chance of blood clots, infections, or wounds not healing properly. Emotional and physical vulnerability of being alone abroad getting plastic surgery. You don't have any friends there, you don't have any family there, you're all by yourself. Surgery is very stressful. It's worrying being under full anesthesia. You're helpless when you can't move and you're sleeping. It can take quite a toll. I know several people who've asked a family member or a friend to travel with them. Several of the clinics in Turkey offer a companion package. Just don't underestimate the emotional toll of going abroad on your own. Hopefully, this list helps you make a decision on whether to go abroad to get plastic surgery or not.